Now, according to the latest data from the CDC, there have been more than 78,000 coronavirus-related deaths in the U.S. This figure, however, does not include those who failed to seek treatment for other life-threatening conditions such as cancer or heart failure because they were either too scared to go to the hospital or their appointment was canceled due to the virus. That means the true death toll could be much higher, possibly even double the official figures, according to some. Should this be something states consider as they begin to reopen their economies? To weigh in, we welcome our panel of medical experts for the day, cardiologist and author Dr. Chauncey Crandall. Dr. Crandall's new book, Fight Back, is available for pre-order on Amazon right now. Also with us this afternoon, emergency medicine physician and co-founder of the telemedicine provider Remote Health Solutions, Dr. Jonathan Baugh. Dr. Crandall, what is your response to those that think the actual number could be higher?
Well, the number could be higher. You mean in terms of people with other disease states other than the virus?
That people have been suffering, as I said in the intro, that it may be a miscount, that the numbers could be higher. Well, let me put it to you this way. What do you think when people say the numbers we're going to reach could be much higher as a result of a second wave? Let me just ask you that.
Well, I think the initial numbers are low, that there are people at home that have the virus that have recovered and have never been documented. And we do know that the second wave is coming and the numbers will be high then. But I would say overall, we here in Florida, we are not seeing that many cases. I don't know if it's because of the warm weather, high humidity, but the case volume here in Florida at our 3 hospitals is quite low.
Well, that's encouraging. Dr. Baugh, what are you seeing in your area as far as cases are concerned?
Yeah, we're seeing the same thing as Dr. Crandall mentions. I practice emergency medicine in very southern Utah. We're a fairly rural area. I work at a large level 2 trauma center, but our numbers of COVID-19 patients has increased recently as our quarantine, as our regulations have loosened over the past few days, but our overall numbers still are low, and so is our mortality. And that's why we've talked so much about the need for regional answers and geographic answers, because we're definitely not the same as many of the densely populated areas. And I think there are so many factors that go into this. I think that we are going to see increased numbers, but those numbers are going to go up and down in a sort of wave-like manner. And we need to keep that in mind as we move forward.
You know, Dr. Crandall, I have a brother-in-law that got COVID-19. He did survive. He had a blood clot, apparently, but now he's on blood thinner. As I'm reading more, blood thinner approaches, drugs that help thin the blood, actually have been a positive approach to dealing with that. Is that what you found?
Well, we are finding this too, because we know by research and documented cases that many of these people that have this viral syndrome have what's called a hypercoagulability state. It means that their blood becomes very thick. It could be because of disorder of blood clotting factors or inflammation in the vessels. And this blood clotting causes damage to the kidneys, to the brain, and other vital organs. So blood thinning medications do work, and we are giving those to the patients that arrive to the hospital.
Dr. Baugh, there's a new study out of Stanford, and they are suggesting that we hit the coronavirus hard and early, and that there needs to be a new focus on testing medicines that can be given as soon as possible over the infection. I mean, as soon as it's identified. Dr. Baugh, what are you seeing as far as treating your patients, and do you agree?
Well, I think part of the problem here is the fact that we're trying to build this bicycle while we're riding it. And so we're trying to figure out treatments and vaccines and medical therapies while we still are having new cases and sick and very sick patients. And I'll say this, one of the things to be able to keep in mind here is, as an emergency medicine physician, I'm not actively treating with IV medications most of those patients because they get admitted to the hospital. Because most of those medications that we are using to be able to treat the patients, remdesivir and other such, they're usually an IV medication that has to be used within the hospital and has to be used within an IV setting. And a lot of people are asking, well, can we use hydroxychloroquine at home? And the recommendation is to be able to, usually not to be able to keep those patients in the hospital where they can be observed because of the known side effects. And so all of these medications that are being used right now, we do need to know more about them. And so that's why there's so many studies out there right now. We definitely need to be able to have something that treats early, that we can use early and often.
Do you think it would have made a difference, though, with hydroxychloroquine if we had known that there would be a difference, perhaps if you give it earlier and sooner instead of waiting?
Yeah, we think we saw that with some of the early studies that early treatment was better, and that the mild, moderate patients did better as well.
Dr. Crandall, there are reports that perhaps this virus goes through the eyes. I don't know if you've seen that or if you have an opinion on that. Does that mean we actually should be wearing goggles? I don't want to be silly about it, but is that a possibility?
Well, any membrane, any mucous membrane, and eyes included, are avenues for the virus to get in. And do I wear goggles in the hospital? No, but if I was in the intensive care unit working on someone very sick where there's high viral load, I probably would wear some form of goggles. But for us, out in public, that's not practical.
Right.
Dr. Chauncey Crandall and Dr. Jonathan Baugh, thank you so much for your time. We really appreciate it. Coming up, we will have continuing coverage of the coronavirus crisis after this.